Do you have any experience?
No, sir, I have no experience, but I'm a big fan of money.
My name is Claire Bowe, owner of Rose Physical Therapy Group. Today, I wanted to talk about some things to consider when looking for a job. Most people think about things like salary, but there's a lot more to it than that, and I wanted to address some of those things. When you think of a list of benefits, there are some of the basic ones that most people know to ask about or to consider. Continuing education, healthcare, 401k, retirement, those types of things. We're going to address those, but there are some others that are maybe less obvious that can make the difference between feeling burnout within your job in a shorter period of time or having a long career, which is, of course, everyone's goal. Continuing education is a big one in physical therapy. No matter where you are in your career, we're always learning and we're always wanting to improve ourselves. It's something we're required to do as part of our licensure, but you can really make the most of that by taking courses that are of higher quality. Some questions to ask when considering your continuing education package: how much your employer would pay for. Do you have to use your vacation time to take courses? What classes would an employer support? Are they dictating what classes you're taking? Is it more open-ended? Is it a conversation as part of mentorship? These are all things to consider. At Rose, we have an unlimited budget for continuing education. We pay for continuing education upfront. We give you 40 hours of paid leave time so that you don't have to use your vacation time to take courses. We even provide an annual stipend to cover things like travel, hotel, food, things like that. We focus our continuing education on courses that really have a diagnostic approach. We want our therapists to walk away with something that not only has a skill component that they can utilize right away, but also something that has a diagnostic component so that we're not just learning treatment, but adding to our diagnostic skills, as the ability to diagnose is what separates us from the other paraprofessionals that we may work with within a physical therapy environment. Mentorship is another big one to consider, especially if you're right out of school. It's also very much tied to continuing education. Mentorship can sometimes be confused with orientation, and even though they are related, they are really two separate things. You're gaining skills and knowledge that you need not just to do the basics of your job, but to be really successful and happy in your job. Some questions to consider are: how much time are you spending with a mentor? How much of that time is one-on-one? Is that ongoing, and how long does it go on for? How long is your beginning orientation and mentorship in the very beginning of your job? At Rose, we take mentorship and orientation as part of it very seriously. You don't see your first full week of clients until week 5 when you start. And that doesn't matter how many years of experience that you have. During your first month at Rose, you're meeting with your mentor throughout the day, every day. Some of that time is spent co-treating, some of that time is spent doing orientation of basic semantics around the clinic, and a lot of it is also spent learning about the cultures and the values and the philosophies that found Rose PT. Some of the things that are ultimately going to make you successful and happy in your job. After the first year, meetings are available to you at the frequency that makes sense to help you with your career development and to help you continue to be part of the team here at Rose PT. The topics of these meetings vary depending on need. It's going to depend on where you are in your career and what your need is at that moment. These meetings can be used to discuss difficult injuries and next steps to take. It can be used to discuss career development. It can be used to discuss continuing education and anything in between. Getting treated yourself gives you context for the skills that you may be learning and or applying. It also gives you an opportunity to get any issues or injuries that you may have treated. One of the things that make physical therapists special is the ability to diagnose. Something to consider when looking at jobs is the support that you're given to always be using a diagnostic framework. At Rose, our continuing education and mentorship is really focused on that diagnostic framework. Anybody can treat. Our true skill comes from diagnosis, and then that guides our treatment and making sure that we're utilizing the correct treatments for the injury at hand. Another thing to consider is the style of care and/or the model that's used at each clinic you may be looking at. At Rose PT, we see our clients one-on-one for 1-hour sessions. This gives ample time for the therapist to diagnose and treat. Another question to ask is about client base. Who's the typical client at a clinic that you may be looking at? At Rose PT, we're very fortunate to have a demographic of client that is motivated and healthy and wants to get well. One of the things that may determine a client base is what insurances or whether or not a clinic accepts insurance at all. At Rose, we accept most private health insurances to make it affordable for people. We also submit claims for people to make our services accessible. A big consideration in joining a clinic is your debt-to-income ratio. This is a consideration for most people and a pretty big one. If you're coming out of school with a lot of debt, you're going to need to consider things like cost of living and maybe a particular city of choice, as well as salary. You may have to make some sacrifices in lifestyle by joining a high-volume clinic early in your career. But plan ahead. Think about lifestyle, especially when you consider the longevity of your career. When I was early in my career, office environment and culture was not something that I had high on my priority list to ask about or to even consider. But now, as I've developed in my career, it's something that's probably at the top of my list in priority in terms of something that I want to be comfortable in my job. When you're looking at potential clinics, it's something that you want to ask about. You want to think about who your coworkers are going to be and the environment that you're working in. Is it an open space? How often are you gonna have time to chat with your coworkers? Is there time for interaction outside of work? Are these people that you would want to interact with outside of work? At Rose, we like to have fun. We have weekly staff meetings with lunch provided. These meetings are more than just meetings. It's an opportunity for in-services, for guest speakers. We've had things like coffee class. We do journal club, among other fun things. We do multiple team outings every year. Those things are things like barbecues and inner tubing and Nats games. It's an opportunity for us to all get together, be relaxed, and have fun. Some of the more basic things to consider when considering an offer, clinic, a job are things like insurance benefits. You want to ask about things like medical benefits, dental, vision, short-term disability, and then, also very important, things like retirement and 401k. At Rose, we provide all of those things. If you're hunting for a job, we want to wish you the best of luck in your job search. If you're interested in applying to Rose PT, you can send us your resume and cover letter to careers@rosept.com.